So when most people think of bite alignment, what they think of is the way that your top teeth come down and touch your bottom teeth. But in actuality, there's a lot more that goes into it. There's really three main components that need to be working and playing really well together in order to have success with your teeth and your bite alignment. And that has to do with your muscles, your jaw joint, and your teeth. And if something is out of line with all three of those, then the whole system doesn't work and can lead to a lot of problems in your mouth. So there's a lot of people out there that suffer from chronic headaches. And a lot of people don't realize and don't think that that can have to do with your bite, but it for sure can. Every single muscle that we use in our head to open, close, clench, grind, those all are in our head and our neck. So if those muscles are getting overworked, we can lead to things like headaches. And as I said before, our muscles, our jaw joint, and our teeth are the three components that need to be working well together in order to have a healthy system there. So if we're leading to things that like having a lot of headaches, having a lot of neck pain, there's very likely something out of line in that system, and that's something that we can help you out with. So after any dental procedure, your bite should feel normal to you. You should not feel like you're biting on a little pebble or a little piece of sand inside of your mouth. When something is off with our bite, we call that an interference. There's something interfering in the way that your teeth should come together. What our body's response to that is going to be is to try to clench and grind to get rid of any of those interferences. Then we can start to break dentistry, break teeth, wear away at our enamel, all situations that we don't want to see. So having the bite feel off, even after one dental restoration, can cause problems in every single tooth in your mouth if it's not addressed in a timely manner. So a bad bite can be caused by things that have to do with a cosmetic flaw. For example, let's say you lose a tooth and you decide not to fill that space back in. Now your teeth surrounding that space have kind of started to collapse on themselves. The tooth above have started to grow out of your bone. So it becomes a cosmetic concern. But a bad bite is not only related to a cosmetic concern. It can lead to a whole slew of problems that can be more detrimental to your mouth than cavities and periodontal disease combined. So when we think about having a bad bite, there is one component of these three systems that isn't working correctly, either our muscles, our jaw joint, or our teeth. This can lead to things like grinding your teeth. Grinding your teeth can start to wear away at the enamel, and once that enamel's gone, we cannot get it back. The enamel is what's really strong and protects our teeth from cavities. So we can have tooth sensitivity, we can start to get a lot more decay. We can also start to break teeth, break any restorations that are in our mouth, and have failure of our teeth in general. Some patients can even wear their teeth down so there's hardly anything left with them, let alone all of the complications that can arise when our bite isn't set up correctly and we start to have issues up in our jaw joint and the components that have to do with our jaw here. So there's a couple different ways that we are going to examine your jaw joint and your muscles and your bite to see how things are coming together. One is going to use radiographs. So we're going to take some x-rays, including a CBCT scan oftentimes, to take a good look at your jaw joint and what's going on in there. We're also going to do a really nice kind of head and neck exam of your musculature. But in terms of another piece of great technology that we have, we use something called a tech scan. And what that shows us is exactly where your teeth are hitting together and how much force they are putting on each other. So we can see how things are distributed. Because it can be challenging as a patient to say, I feel like I'm hitting over here, or I feel like I'm hitting over here. But when we can see that displayed on the screen for us, we can see exactly how those teeth are coming together, so we can help you fix that. Resolving your bite issues can lead to fixing a lot of problems for you. Like we discussed before, there are people that have chronic headaches that just think every morning I'm just going to wake up with a headache and that's the way it is. Once we resolve their bite, a lot of these people find they no longer have these headaches and their quality of life goes up immensely. Same thing with their quality of sleep. There are people that don't realize that they are waking themselves up by clenching and grinding their teeth at night, and they feel much more rested in the morning. We've also had patients that have spent thousands upon thousands of dollars getting Botox put in their muscles to help with the clenching and grinding. Once we get in there to kind of help out with their bite, they realize they no longer need to do that quite as often, so they can save themselves some money in the long run.